The Adolescent School Health and Nutrition Interactive Decision Trees explores 4 processes along the continuum of preparation and implementation of school health and nutrition programming. 1. The policy environment that underpins the National School Health and Nutrition Program. 2. The considerations for determining the basic package of school health and nutrition services. 3. The considerations for equitable delivery of school health and nutrition services, and 4. The budgeting and financial flows to support the delivery of school-based health and nutrition services. Through this tutorial, we will show how to best use and apply these tools to your current work. This tool is designed to be interactive. Each decision tree is intended to be viewed as a holistic overview of the types of questions a practitioner might explore to strengthen the respective dimension of school health and nutrition. You can engage with each decision tree by answering the proposed questions, and depending on your answers, a text box will appear suggesting next actions you could consider. Most decision trees have multiple trains, which all culminate with the same endpoint: a focus on programmatic monitoring and evaluation of school health and nutrition activities under implementation. The suggested actions to consider are tailored by the decision tree. Users of these tools can easily jump to another decision tree by clicking on the tabs in the right-hand column. Similarly, practitioners can find relevant resources for each decision tree by clicking on the Resources button within each decision tree. Now, by using a hypothetical scenario, we will illustrate how to best use these interactive decision trees to guide the development and expansion of adolescent school health and nutrition programs tailored to a country's needs in 4 key areas: policies, interventions, implementation, and financing, coupled with monitoring and evaluation activities, which are cross-cutting and thus integrated into each of these 4 areas. Let's get started. About the task. You are a senior education specialist who is in the early stages of developing a concept note for a new human capital project in Caledonia. The government has identified adolescent girls as the primary beneficiary for this investment to increase secondary school completion and the human capital potential for their future offspring. You recently learned that health services delivered to adolescents in schools can improve learning and well-being, and that schools as the delivery mechanism could be an effective way to deliver these services for cost efficiency and service coverage gains. With that, you want to explore whether a school health intervention would be appropriate for this investment. So, how to best go about it? By using the tools provided in the Adolescent School Health and Nutrition Interactive Decision Trees, you can start by exploring whether Caledonia already has a supportive policy environment for school health and nutrition. Following the Adolescent School Health and Nutrition policy track within the Decision Tree tool, you can identify which questions could address your query. In this case, the most suitable question to ask your government counterpart could be: is adolescent school health and nutrition, or related topics, included within a published national policy? When asked this question, your government counterpart confirmed that indeed, Caledonia does have a published national policy and shares a copy, so you familiarize with what it encompasses. Since the development objective for this new investment will likely focus on secondary school completion, you check to see if the policy identifies a core set of interventions for delivery in secondary schools. Based on your reading, you determine that the policy does specify an essential package of school health and nutrition services to be delivered on a routine basis to older students. Because the government of Caledonia is prioritizing adolescent girls, you check whether the school health and nutrition policy accounts for the different health needs of male and female students. You conclude that the policy does not include language on gender-specific health considerations in its basic package of services. By using the decision tree as a guide, you were easily able to identify several starting points for both a desk review and conversations with country counterparts around possible entry points to strengthen the gender lens within the existing policy and program. As shown in the actions to consider, these include financing research on the benefits of gender-specific SHN interventions, holding in-country consultations at the national, subnational, and school level, incentivizing policy change through World Bank financing levers, Identifying where indicators that are already collected can be disaggregated by sex. Consolidating policies that can serve as examples for the inclusion of gender-specific SHN interventions. Lastly, since you are in the preliminary stages of assessing whether school health and nutrition interventions are the best approach to meet Caledonia's development objective, you decide that the next step is to do some desk research, starting with consolidating and comparing policies for examples of policies where the different health needs of male and female students are considered. Now that you have consolidated school health and nutrition policies from countries across the region to assess how these account for the different health considerations for adolescent male and female students, you want to best identify relevant interventions for your targeted students, which is in this case are female secondary school students. For that, you use the second tool in the Adolescent School Health and Nutrition, Interactive Decision Trees, defining the package of services. With this tool, you cross-reference the second section of the tool in order to identify relevant interventions for adolescent secondary school students. Since the question you are aiming to answer relates to appropriateness of interventions by sex and development stage, you refer to the column Considerations for defining a relevant and appropriate package of services and select the box entitled Optimal Timeframe for delivering select health and nutrition interventions. This brings you to a graph which shows the optimal timeframe for delivering school health and nutrition services to adolescents. As shown, this figure aims to illustrate that the grades in which of these services are provided can be quite fluid, with the blended colors reflecting where they may be overlap between service provision occurring in primary versus secondary schools. By referring to this figure, you see that intermittent iron and folic acid supplementation is an intervention that can be delivered to menstruating adolescents. As you identify this, you are keen to know more about intermittent iron and folic acid supplementation, and for that you once again look to the Defining the Package of Services decision tool, where you can find specific information under Nutrition Service Delivery in Schools as shown. Here, you now learn that the benefits of intermittent iron and folic acid supplementation align well with the development objectives of this new project because intermittent IFA supplementation has education benefits. Oral supplementation programs can reduce anemia among adolescents, and adolescent girls are at higher risk for developing anemia due to onset of menses. By using the tool as a guide, you are easily able to identify possible activities to support or complement a component on school health and nutrition within the new investment. These include developing or strengthening the nutrition curriculum to include messaging on micronutrient-rich and iron-rich diets, complementing IFA with micronutrient-fortified snacks and/or school meals, allocating resources to train teachers to deliver and monitor weekly IFA supplementation to menstruating adolescents, and developing and maintaining an up-to-date contingency plan for IFA delivery and monitoring during school closures and instability. In addition, to learn a bit more about intermittent iron and folic acid supplementation, you refer to the Resources tab and navigate to the section that consolidates resources to design and implement the essential package of adolescent school health and nutrition services. By reviewing the WHO guidance on intermittent iron and folic acid supplementation in menstruating women, you learn that IFA supplementation should be delivered in settings where the prevalence of anemia exceeds 20%. You check to see whether Caledonia has a high prevalence of anemia, and you learn that in fact it does. With this review, you now feel confident that this is an appropriate intervention to propose for the new human capital project. Based on the decision tool, you are curious to know whether it would be possible and appropriate to allocate resources through the proposed project to ensure that the National School Health Program includes intermittent IFA supplementation, alongside a curriculum that includes messaging on micronutrient and iron-rich diets as a complementary intervention. How can the Implementing the Package of Services decision tree best guide your next steps? You get in touch with your government counterpart to ask whether schools in areas with the highest levels of iron deficiency receive supplemental IFA. By doing that, you learn that the delivery of school-based weekly IFA supplementation was recently piloted in one region with high levels of iron deficiency. Referring to the Implementing the Package of Services decision tree, you want to know whether the pilot is reaching the target population in the country. Your government counterpart explains that because the program is still a pilot, it is not yet reaching the target population in all regions with the highest rates of iron deficiency in the country. Referring to the suggested actions in the decision tree, you discuss conducting a SWOT analysis of the current pilot during the project preparation phase to inform the opportunities and challenges with scaling up the pilot further. Recognizing that health and nutrition services can be paired with health education, you want to know whether the existing nutrition curriculum for secondary schools includes a focus on micronutrient deficiencies. Referring to the Implementing the Package of Services decision tree, you ask your government counterpart, do schools have a mechanism to align health education with health services? And you learn that the curriculum does not yet include a focus on micronutrient deficiencies, and teachers also do not receive pre- or post-service training on this topic. Looking at the tool, you see several actions to consider, which are as shown. 1. Encourage representatives from the MOH and MOE to collaborate on developing age-appropriate and accurate health messaging for updated textbooks and teacher training manuals. 2. Expand teacher trainings to account for health and nutrition education as well as appropriate health service delivery. 3. Ensure that messaging used in school curricula and teacher training modules is consistent and aligned with messaging used by the health sector. 4. Consider opportunities to disseminate accurate health messaging in alignment with planned health service delivery, including through radio, posters, and engaging community health workers to further amplify the messaging. 5. Advocate for the education sector budget to include resources to introduce or improve health-promoting infrastructure. The first three of these suggestions are particularly relevant to the idea of updating the national curriculum to include messaging on micronutrient-rich and iron-rich diets. These actions would then be supported if the project were ultimately funded. Following the tools, your next challenge is to assess the budget implications of introducing weekly IFA supplementation and complementary education services. Stated another way, is there a financing gap that the World Bank could help Caledonia meet to scale up its essential adolescent school health and nutrition program? To guide this reflection, you refer to the Financing the Package of Services decision tree. Using this decision tree, you start by asking your government counterpart, is there sufficient funding to provide the adolescent school health and nutrition benefit package? To better understand whether additional resources are needed to increase the scope of the existing National School Health and Nutrition Program. By following this train, you learn that the essential package of school health and nutrition services is not fully met by domestic resources, and that additional and supplementary resources would be required to expand the essential package to include intermittent iron and folic acid supplementation in schools and to update the curriculum. The recommendations from the decision tree suggest several actions, including 1. Conduct multi-sectoral resource mapping of government and donor resources. 2. Conduct a financial gap analysis to understand resource sufficiency by combining resource mapping and costing data to key funding gaps and where duplication/overfunding should be addressed. 3. Assess education fiscal space to provide in-service and/or pre-service teacher training on health, nutrition, and physical education to ensure smooth implementation. 4. Advocate for additional resources to be allocated to adolescent school health and nutrition programming through stakeholder engagement, political economy analysis, and financial gap analysis/investment case. 5. Utilize economic methodology to ensure adolescent school health and nutrition budgets at the central and subnational levels are accurate and realistic. Based on these suggestions, you decide to start with the first suggestion of mapping government and donor resources to finance the school health and nutrition program in Caledonia, as this will clarify how a new World Bank investment could fill the gaps to finance an intermittent iron and folic acid supplementation program. To complete this task, you hire an in-country consultant to conduct a multi-sectoral resource mapping of government and donor resources to find out what resources are available to deliver the benefits package and associated health systems strengthening. Ideally, this would be disaggregated, at minimum, by geographic unit and program intervention/sub-intervention, and include implementer detail. Concluding message. As seen, the interactive decision trees can usefully prompt questions, recommend supportive activities, and inform decision-making to achieve stronger policies, interventions, implementation, and financing approaches for school health and nutrition programs. Thank you for completing this learning resource. To complement your learning, feel free to explore other modules in this series.